Hello everyone, thank you very much for attending today's webinar all about UriPurin, which is our uric acid support and mobility formula. My name is Enver Kelesade. I am a clinical nutritionist and researcher in the field of gut health, immunity, and metabolic disorders. First of all, I would like to start with what is purines, basically. Purines are organic nitrogenous substances that are part of DNA, RNA, and energy sources, for example, ATP and intracellular enzymes that ensure the vital activity and health of the cell. These substances are necessary for the storage, modification, and transmission of genetic information, cell growth and division, energy storage, and signal transmission. Purine metabolism is a set of processes for the synthesis and breakdown of purine nucleotides. The end product of purine metabolism is uric acid, and the defects in these enzymes involved in different stages of purine metabolism can lead to the development of various conditions. And the excessive amounts of nitrogenous bases and their metabolites accumulate in cells and biological fluids, which can be toxic and can damage the genetic material and functions of the cell. The most important disorders of purine metabolism include the excess formation and gather of the uric acid, such as in gout, and hyperuricemia and gout in young or childhood are most associated with heredity defects in purine metabolism enzymes. And in people over 40 years old, hyperuricemia, which is an increase in the level of uric acid in the blood, is associated not only with a genetic predisposition, but also with dietary habits, alcohol consumption, and impaired excretory function of the kidneys. And excess uric acid triggers aseptic, which means basically non-infectious inflammation in all organs and tissues. And historically, gout also is known as a disease of kings, which was because in history, generally people who suffer was mainly rich and noble people from the kingdoms, and as they know as the disease of kings, basically, as they know to consume large amounts of alcohol, smoked fatty meats, or other delicates. And some of the examples in the history, like Alexander the Great, Julius Caesar, and these all suffer from the gout. Gout, in Greek, or it's known as like a food trap, is a metabolic disease characterized by the deposition of uric acid crystals in various tissues of the body. Clinically, gout is manifested by recurrent acute arthritis and the formation of inflammatory nodes known as tophi. And kidney damage is also one of the main clinical symptoms of gout, along with arthritis. And before menopause, in women, they generally rarely become ill from this condition, but due to the effect of estrogens on the excretion of uric acid. And gout is more common in men, but in recent years, the prevalence of gout has increased with age among women as well. And at the moment, hyperuricemia is found in 4 to 12% of the population, and the ratio in men to women is from 7:1 to 19:1. And the peak incidence is the highest observable rate, basically, is seen in men between 40 and 50 years old, and in women about 60 years of age and older. And when we look at the worldwide incidence, we can see that in Russia, only 0.1% of the population is affected, whereas in the US and in Europe, 2% of the population is affected and is generally prevalent among men between 50 to 65 years old and 4 to 6% of the population. And basically, who suffers from the gout? And here I would like to show on the right hand side, there's some groups basically, is generally men, usually over 40, and menopausal women, people who are overweight, people who use excessive amounts of alcohol, and people who frequently use diuretics to lower blood pressure or treat chronic heart failure. And excess uric acid not damage the endocrine part of the pancreas, resulting in disorders of carbohydrate and fat metabolism. Insulin resistance causes obesity, fatty liver disease, which contributes to the development of atherosclerosis, organ ischemia, and increased blood pressure. Insulin resistance also develops type 2 diabetes, which then turns into insulin deficient like type 1 in diabetes. And gout is often accompanied by cholestasis, urolithiasis, and significant changes in the kidneys. And gout attacks provoke alcohol intake, hypothermia, physical and mental overstrain, and usually begin at night with severe pain in the joint of the big toe. Kidney damage develops in 30 to 50% of patients with gout, and it's a non-infectious inflammation of the kidney tissue with subsequent shrinkage of the kidneys. And chronic renal failure, tophi in kidney tissue, and urate stones. And here is the normal levels, but these numbers vary between laboratory to laboratory or country to country, but in general it's recognized that the mean of like a 4.0 milligrams per deciliter, and in men it is known as the general norms is 420 micromoles per liter, and in women 360 micromoles per liter. And here is what leads to an increased uric acid level. First is the deficiency of enzymes involved in the metabolism of uric acid. If you remember my first slide, where I mentioned this one. And second is the increasing the turnover of nucleic acids, which may occur in individuals with hematologic malignancies such as lymphoma, myeloma, or leukemia. And for individuals that are rich in meat, organ meats, and legumes can lead to excess uric acid production and impact of persistent organic pollutants such as organochlorine pesticides. And of course, as I mentioned previously, alcohol. Basically, ethanol increases the formation of uric acid by increasing the turnover of adenine nucleotides. It also reduces the excretion of uric acid by the kidneys. And fructose and soft drinks, they all lead to increased uric acid, such as fructose increases serum uric acid levels by increasing purine synthesis and decreasing renal excretion of uric acid. And finally, heavy physical activity. Exercise can lead to an increased tissue destruction and reduced renal excretion of uric acid due to decrease in circulating blood volume. But I need to emphasize, it's heavy exercise. What leads to a decreased excretion of uric acid, which is very important for on the pathogenesis of this condition. And basically, idiopathic. Basically, the cause is unknown, and the heredity got nerve and kidney failure is known as like high acids in the bloodstream, which is such as lactic acidosis, diabetic ketoacidosis, alcoholic ketoacidosis, and fasting ketoacidosis. Diseases such as toxicosis of the second half of pregnancy, hypothyroidism, hyperparathyroidism, psoriasis, sarcoidosis, which is an autoimmune connective tissue disease. Lead intoxication is another condition that leads to a decreased excretion of uric acid. Influences such as lead. So, what do we have to do if we're suffering from these conditions, or if we don't want to suffer these conditions? Basically, we have to eat foods with less content of purines. And as I mentioned, purines are chemicals that are naturally produced by our body and are also found in certain foods, such as animal-derived purines from meat and seafood can particularly affect uric acid levels. And most people generally eat more purines than they think. And here on the right hand side, I would like to show the foods that are high in purines. So you should avoid, limit their intake to help you lower uric acid levels. Growth in their byproducts like kidneys, liver, lung, and brains, and fish broth, mushrooms, certain vegetables, yeast, legumes, and cold cuts such as crust and cereals. And here on the pause, we have foods that can help you to get rid of uric acid, such as any fresh fruits like berries, and after heat treatment, nuts and peanut butter, potatoes, carrots, zucchini, milk and dairy products, vegetarian soaps, eggs, wheat bread and rye, butter and vegetable oil. These are all can help you to get rid of your uric acid. And here it says more vitamin C. But researchers have found that vitamin C can help lower acid levels. As I said, in a 2005 in study published in the journal Rheumatism, participants who took 500 milligrams of vitamin C daily for 2 months compared to who took a placebo. However, this may not be true. In 2013, in a study conducted and published in the Journal of Arthritis and Rheumatism again, found that participants with gout who took 500 milligrams of vitamin C daily for 8 weeks didn't significantly lower the uric acid levels. Also, if you don't, you should talk to your doctor about vitamin C intake. This can increase your risk of kidney stones. So, what increases excretion of uric acid? Basically, you have to minimize alcohol and sweet beverages. According to the third US National Health and Nutrition Study, published in the journal Arthritis Care and Research, and basically drinking beer and liquor increases uric acid levels. This is because alcohol increases the amount of purines in the blood, which leads to the production of more uric acid. Beer has the most purines, while wine has the least. And to lower your uric acid levels, avoid the following drinks: beer and liquor, soft drinks with sugar or high fructose corn syrup, juices with high fructose corn syrup. We must avoid them in our diet. And basically, and another factor is they have a drink of coffee. Coffee contains an antioxidant called collagenolic acid, which can lower uric acid levels and even prevent gout. For example, according to a 2007 study, men who drink 4 to 5 cups of coffee a day have a 40% lower relative risk of gout than men who don't drink coffee. And the Mayo Clinic reports showed that drinking up to 4 cups, which equals to 400 milligrams of brewed coffee daily, is safe for healthy adults. But drinking more alcohol can lead to caffeine-related side effects such as headaches, insomnia, and nervousness. And basically, to help us to increase the excretion of uric acid from our bodies, we need to lose weight as well if we have excess amount of body weight. And basically, weight loss can lower your uric acid levels. And being overweight or obese reduces the efficiency of the kidneys in removing uric acid in the urine. And research has shown that watching what you eat and maintaining a healthy weight can help lower uric acid levels. And of course, this may not be enough for some people, and you will need to take medications that can effectively lower uric acid levels. Depends on the severity of the condition. And here I would like to show the composition of our UriPurin and slightly go one by one of these ingredients. The first compound is Sustadex. Basically, it's a biologically active complex for the correction of purine metabolism and lowering the level of uric acid in the blood, such as It's basically is a mixture of devil's claw root extract, instant gum, and boswellia extract. Udex basically is a selective sorbent, which is a derivative of dextran. Devil's claws, or Harpogostum procumbens in Latin, basically it has a large hook-shaped fruit that called devil's claw, also known as in the literature like a grapple plant or wood spider. And devil's claw, like historically, was used in medicine for various diseases and primarily for gout and rheumatism, and quickly eliminating the joint pain. Scientists around the world continue to search for funds that could not only help the joints, but also not have side effects on other organs. And German scientists over the past decades, in a number of studies, have shown that the properties of the devil's claw extract, which has a complex effect on the entire musculoskeletal system in osteoarthritis, rheumatic, muscular, and lumbar pain. It turned out that devil's claw extract simultaneously reduces pain, relieves inflammation, and stops the destruction of cartilage tissue, increasing the mobility and flexibility of the joints. Furthermore, it inhibits the formation and release of inflammatory substances from macrophages. It inhibits the development of lipid peroxidation, which leads to a suppression of the inflammatory reaction, and secondarily to the development of an analgesic effect and contraprotection, which means protection of the joints. And it increases the solubility of uric acid salts in the tissues and facilitating their excretion. Clinical studies show that devil's claw extract in individuals with osteoarthritis, it reduced the severity of pain by an average of 25 to 50%, which is very clinically meaningful. And it increased joint mobility by about 35 to 50%. And with lumbar pain, it reduced its severity by 40 to 50%, and the pain completely disappeared in 2.5 to 20% of patients. And it was effective in generalized and localized forms of fibromyalgia. The use of devil's claw extract for any type of musculoskeletal pain resulted in about 60% of patients reducing the dose or completely stopping the use of non-steroidal and steroidal anti-inflammatory drugs. Devil's claw extract contributes to improving the mobility and flexibility of the joints and spine, reducing inflammation and pain in the joints and against the spine, and reducing the risk of cartilage, the tissue destruction, and it normalizes uric acid levels. And long-term use of devil's claw extract is safe and not associated with the development of toxic effects. The longer the patients took the devil's claw extract, the more pronounced its healing effects were. And taking devil's claw extract for 1 year retained and even slightly increased the effect achieved during the first month and a half. And in contrast to synthetic medications such as NSAIDs, it doesn't cause any dangerous side effects. And even taking for a long time has anti-inflammatory, analgesic, and contraprotective action. And the next ingredient, as I mentioned, is boswellia, which is a genus of low trees of the Burseraceae family, common in tropical regions of Africa and Asia. Basically, it consists of medium to small trees or shrubs, and boswellia is very popular, and most people know it by its common name, Indian frankincense. And farmers collect resin from the tree, which has a rich aroma and a taste. And boswellia extract has been used in Ayurvedic medicine since the immemorial and has been highly valued for its anti-inflammatory and antiseptic properties. For this, the Indian begins to call boswellia an inflammation fighter. Its aromatic resins contain boswellic acids, and the mechanism of action of which is the same as that non-steroidal anti-inflammatory drugs such as ketoprofen, aspirin, and indomethacin, but without inherent side effects such as ulceration of the mucous membranes of the gastrointestinal tract, and bronchospasm, and urticaria, and toxicity. Boswellic acids weaken the inflammatory process, reduce the degree of damage to the articular cartilage, and this helps to reduce pain and swelling as well. And boswellic acids also enhance microcirculation, strengthen blood vessels, improve the access of nutrients to joints and muscle tissues, which speeds up their recovery. In 2008, in British Medical Journal, in a systematic review published, the review basically used like Boswellia resin extract, and it included studies on the efficacy of Boswellia resin extracts in arthritis of the knee and hip joints, and bronchial asthma, Crohn's disease, inflammatory bowel disease, and rheumatoid arthritis. In the vast majority of the studies included in this systematic review, a pronounced therapeutic effect of preparations based on Boswellia resin extract and their high safety were noted. In clinical trials, it was found that when taking Boswellia for 3 months, there was an effective in reducing in swelling and pain in patients with rheumatoid arthritis. Authors point that high potential anti-inflammatory drugs based on Boswellia resin extract and called for further research. Studies have shown that Boswellia extract protects the inner intestinal epithelium from damage. It reduces level of glucose, cholesterol, triglycerides, urea, and creatine. Furthermore, it reduces the ratio of progression and improves the prognosis of disease in disease of the central nervous system, such as Alzheimer's disease, Parkinson's disease, cognitive impairment, and improves memory and learning. It has a protective effect on male fertility. Basically, it increases the sperm motility. It relieves eczema and psoriasis and removes inflammation and irritation. It improves skin elasticity, prevents photoaging, and removes fine wrinkles. And taking Boswellia in diseases of the joints and spine can significantly reduce the dose of non-steroidal medications, as I mentioned. And as I mentioned, the selective sorbent UDEX basically is an inert polymer that is able to remove excess uric acid through the intestines, ensuring its normal concentration in the blood. It doesn't absorb the other substances and has a high affinity only for uric acid molecules. And here we have gum arabic, which is a high quality natural acacia gum. Its chemical composition is complex mixture of polysaccharides and glycoproteins. As I mentioned, gum arabic is a soluble dietary fiber that is not absorbed in the human gastrointestinal tract, but it's fermented in the large intestine under the action of microorganisms into a series of short-chain fatty acids, which means this is a prebiotic. It enhances the growth and reproduction of beneficial gut microbiota. And they are widely used in various areas of the food and non-food industry under the name of useful food additive E414. It is a regulator of structure, consistency, stabilizer of dispersed systems, film former, and etc. And ingestion of gum arabic by mouth is associated with many health benefits to start with, such as it's not an allergen. It removes salts of heavy metals and radionuclides from the body. It helps lower glucose and cholesterol, such as LDL cholesterol and triglyceride levels, and thereby promoting the weight loss as well. And it tends to prolong the digestive process, which means that the feeling of satiety remains for a long time. Basically, you feel fuller for longer, and improves calcium absorption from the gastrointestinal tract. It improves the body's immune function by modulating the release of certain inflammatory mediators. It improves intestinal barrier function to prevent colon cancer and relieves symptoms of irritable bowel syndrome, which is also known as IBS, and has a protective effect on the intestines against the adverse effects of NSAIDs. The results of laboratory and preclinical studies of dietary supplements showed that one capsule of the Sustadex basically is capable of removing up to 0.4 millimole per liter of the amount of uric acid and its derivatives from the blood. As a result of study, a sharp, significant decrease in the level of uric acid, even to a normal value in the blood, was seen. Thus, the high efficiency and selectivity of the Sustadex dietary supplement components in relation to uric acid and a positive effect on pre-metabolism were established. No toxic effect was found as a result of the experiment. Basically, none of the participants showed any adverse effects. And in addition, the product improves intestinal motility, normalizes gut microbiota, promotes detoxification, which favorably affects purine metabolism. So, who should take UriPurin? Basically, patients of gout and individuals who suffer from hyperuricemia, degenerative and dystrophic pathologies of the spine and joints, such as patients with osteochondrosis and osteoarthritis, individuals with autoimmune arthritis and polyarthritis, individuals with lipid and cholesterol metabolism disorders, individuals with type 2 diabetes, fatty liver disease, inflammatory bowel disease, bronchial asthma, and people who consume high amounts of meat, alcohol, and sugar, if you remember from my earlier slides. The recommended daily dose and instructions to use the UriPurin is to take 2 capsules 2 times a day with meals, and you should take at least for 3 months. Thank you very much for attending today's webinar all about UriPurin. Have a nice day.